on this episode of Bondi Vet.
Oh my gosh, Mummy's gonna be late.
A busy day for Alison, juggling patients and party planning.
It is multitasking from the moment I wake up.
An age is just a number.
One of Scott's oldest patients needs life-saving surgery.
Everyone ready?
But will she survive the operation?
Unfortunately, they can respond badly to anesthetic and things can go downhill very quickly.
Hey, ease up, ease up.
Tim takes on the king of the Australian rainforest.
They're really powerful. About the same force as a male red kangaroo.
There it is.
And what on earth has this curious cat swallowed?
Oh my gosh, look at that.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
Are you going to show me that you deserve it? Are you going to say hello to me? High five, yes. Here's Daddy's baby.
In Kew Bridge, it's a nervous time for besotted owners Bobby and Mary.
Here you go. Good girl.
Their beloved 17-year-old Lucy is booked in with Scott for surgery to remove a nasty lump.
In 2014, we noticed that she developed a little bit of a lump on her backside. It was determined that it was a low-grade sarcoma. So she had the first surgery back then.
But the lump keeps growing back, and Lucy is now facing her third surgery to remove it.
It's always the same exact position.
It looks tiny from out
Yeah, it's kind of like a little bit like maybe smaller than an almond.
Now that she's 17, Lucy's constitution isn't as strong as a younger dog's, increasing her risk of not waking up from the anesthetic.
Lucy is a senior citizen, so there's always the bit of risk, and of course we're a little bit concerned, but I think it came to the point where we got to do something about it. But I'm pretty confident that Scott, he's going to be able to take care of this, and we're going to make her all better.
Yeah, we're gonna make you all better.
Is
You
that
ready
right?
now? You ready
Is
for
that-
your walk?
Yeah. What do I got here? What do I got here? Uh-oh, don't get mad at me. That's my finger, actually.
You're such a piglet.
Bobby and Mary adopted the playful little bulldog Chihuahua cross 11 years ago, when they were living in the United States.
Ready? Quick, quick. Good girl. Now we need your scarf. I don't know what I would do if I didn't have Lucy. She just gives me the company that I need. And whenever I'm not feeling good, I just curl up on the couch and I bring Lucy by my side and she makes me feel better.
So what do you think? It's not that bad of a day.
No.
That's pretty nice.
Come on, Mama, we're gonna sit
What is
for a
it,
little
Pumpkin?
bit.
You want to take a load off?
Lucy is booked in for the risky surgery tomorrow.
You're always debating yourself, and there is absolutely no doubt. You always want to make sure that you're making the best decision for your pet. Good girl. Of course, I'm still going to be a nervous Nelly, but I'm willing to do that because I think the longer-term solution for Lucy is we gotta have it taken care of, and of course, it's her well-being. You ready to go?
Good girl. Come on, Lucy.
Okay, little one.
Come on, let's go see Scott.
Here we are.
Hello, guys.
Hi, Scott.
How
Hi,
are you?
Scott.
Hi,
How are
Bobby.
you?
I'm good. How are
Nice
you?
to
mate?
see you.
Good to see
How
you.
are you?
Hi.
Ah.
Good to see you.
And you. Hello, you.
Say hi, Scott.
Hi. Usual
ready.
grumpy old lady.
Hey.
She's a bit edgy today, Scott. She didn't get any of her cookies, so she's waiting for the cookie fest later on.
All right. Well, let's get you in the consult room and we'll just chat through a few bits and pieces.
I'm a nervous Nelly, but I'm okay. I'm ready for Lucy to get this surgery done and over with and get Lucy back home.
So I'm just going to have a little look at this back and then just see where we are. Yeah. So even just from very recently when I last saw her, it's grown, it's got bigger, okay? And actually it's significantly larger when you sort of pressurize and press around it. It's quite big indeed. It actually goes from here all the way to here. So that said, the positives is that otherwise she's an incredibly healthy girl, isn't she?
Yeah.
We've done blood tests on her as well, and we've seen that her bloods are immaculate. There is nothing to suggest that she's 17 on those bloods. And age is just a number.
There you go. That's the right attitude.
Yeah. And as a result, we don't want to let something get in the way of her continued longevity.
Right.
Yes.
Although I believe this tumour to be low grade, so low-level malignant tumour, and that it should be unlikely to spread anywhere else in Lucy's body, it is now affecting her anus. Already you can see that the anus is sort of skewed to the left. The mass is developing on the right and pushing it and pressurising it. At some point she'll have issues with going to the toilet, and there's enough indignities growing old
Right.
without
Absolutely.
I don't
them
want her to do
Yes.
that.
being constipated as well.
Right.
Yeah.
But obviously, it is still a risk.
I know a lot of people would consider a pet. I consider my pet my daughter. And so it's a very hard decision to try to understand what is absolutely the right thing to do to improve her life, giving her lots of longevity.
Nice and strong
Good girl.
and slow and steady. Yeah, I have a sense it'll be slower than the heart that's probably worked. Just here, let's have a little listen. Yeah, I'll have to have the crash card out.
I believe so.
Yeah. I've got the paddles waiting for him, not for her. Hey, I've got to make them laugh, otherwise they'll
Yeah,
cry.
I know.
You see? So that's what I'm doing.
Good girl.
That's great.
All right. You guys
Ready?
okay?
Yeah.
We're okay.
Ready.
You ready?
Ready.
We're ready.
Lucy is the oldest dog that I've ever performed surgery on. I don't undertake the surgery lightly, but the fact is that without doing this procedure, this lump eventually will cause Lucy to be constipated. She'll need more medication, she'll need consistent treatment, and that's not a good quality of life. So I really feel that the time is right to get in there, to grit our teeth, to hope for the best and remove this mass.
Scott has enlisted his most experienced nurses, Jess and Nathan, to assist with Lucy's procedure.
Okay, good. Her heart's strong. She's responded well to that pre-med, so she's a little bit dopey. We can take that off now, hey? During the induction process is when most amount of complications can occur because, unfortunately, they can respond badly to anesthetic and things can go downhill very quickly. Okay, so everyone ready to go?
Yeah, all good.
All right, baby. Now, the key is waking up. Yes? Sleep, sweet dreams, sweetheart. 17 is a whopping age for any dog, but the fact is that without doing this procedure, this lump eventually will cause Lucy to be constipated, and she is otherwise incredibly healthy. We've done bloods on her, her heart is strong, so I really feel that the time is right to get in there and remove this mass. Jess, you're happy?
Yeah.
Okay, so it feels like we've just jumped through that first initial hurdle, so that's good. Luckily for us, Lucy starts breathing straight away. She seems quite comfortable under anaesthetic, and actually for all the concern and the worry that's built up regarding this dog, everything's going quite nicely. But let's not be complacent. So Jess, if you continue to focus on the anaesthetic, Nath, if you clip and prep her, and then I'll go and get ready. So far, so good. Thank goodness for Lucy's anaesthetic. She is responding quite well. We are managing it quite lightly, so just keeping her breathing, and Jess is stuck to her like glue, and I'm nervous. I'm just trying to scrub my nerves away and just get the best result for Bobby and Mary.
She's breathing really nicely.
Jess and Nathan will be closely monitoring Lucy's vital signs throughout the surgery.
Okay, everyone ready? I'm hoping that the tumour removal won't actually be too hard. I'm hoping it'll be a little bit like peas out of a pod. Once I've cut through the pod, I'll be able to pop out the peas. In some ways, almost wants to fall out. But I'm just sort of encouraging it, but at the same time, I have to be so careful because there's some really important nerves in this area, and if I make one wrong move, I can make Lucy incontinent. So I have to just be methodical and very careful, but so far, so good.
With the tumour out, Scott will now try to remove as much of the surrounding tissue as possible to reduce the chance of the cancerous cells growing back.
There's a big crater here where those lumps have come out from, and then just seeing what I can remove from around the outside, because there will still be some cancer cells around, I know that I'm not going to be able to remove enough for cure, but Lucy is 17. So what I need to do is to put her out of immediate danger and give her last twilight years comfort. So flush, and we can close up. We're nearly there. Things are looking good, but we don't want to tempt fate. Last suture. So that's that.
Happy to turn off?
She can turn off. Okay, and let's watch her like a hawk.
Yeah.
This is a dangerous moment for a dog waking up because you're bringing them out of the maintenance of anesthetic. So it's where the heart and the lungs need to change, and there's lots of physiological changes associated with being woken up. And sometimes that can react badly with the anesthetic and you can have issues. And hopefully she'll wake up and come back to us very soon.
You're gonna wake up?
Come on then. Come on. Go. Nice strong pulse back here, so that's good.
Oh, there she is.
Oh, hey,
I'll have that,
baby.
thank you. Yeah, I can breathe a lot easier now.
Well done, everyone.
Good job.
Good job. Beers are on me tonight at the pub.
I was
Hey.
gonna say, I think I need something more than a tea and a biscuit.
Yeah, totally.
The tense surgery has gone without a hitch, and a relieved Scott wants to share the good news with Bobby and Mary.
How's she
Look
doing?
who it is. Here she is.
Still here? Oh my goodness. Yeah. I did so much.
So how did she make out?
Well, as far as the lump itself, it was exactly as I thought it was. It was the little tip of the iceberg that you could feel, but then underneath there was a mass about 4 or 5 times that size.
Right.
Wow.
Okay.
Now you need mama's loving, huh?
Yeah. Good girl. Very relieved.
For me, the world has come off my shoulders. As soon as I walked down the steps and turned this corner and saw her already awake, it's the best result that anybody could ever have hope for. So I'm sorry, I know I'm a wimp.
You're a good girl.
And you, Scott, you are my hero.
You're welcome, Bobby. You're welcome. My pleasure.
Lucy will need to stay at the practice for further monitoring, and hopefully will be able to go home with Bobby and Mary later this afternoon.
All right, little one, see you soon.
See you soon. Thank you.
All right.
We'll be right back.
Bye, guys.
In Kew Bridge, Scott is checking up on 17-year-old Lucy, the oldest dog he's ever operated on,
Well, hello, lovely people. How are you?
How are you?
and her relieved owners, Bobby and Mary.
Good to see you.
Hello, gorgeous girl. How are
she
you?
is.
How are you doing?
She's doing very well.
Yeah.
In the last 10 days, I've been bringing her to the park and for walks, and
She's recovered very quickly.
She actually, I think she's doing quite better than what
I
she
think
was
so, too.
before the surgery. She is really back to that loving, happy-go-lucky, I want to run to the park, Dad. Let's go for it. And I think that makes all the difference in the world for me.
And let's hope the third time's a charm this
Definitely.
time. Because the results are back in from the lab and the pathology has come back as a sarcoma. Now, that won't frighten you too much. It's a malignant type of tumour.
Right.
But that's exactly the same result as has been present the last 2 times. And it might return to that area, but she is 17. So if we can buy 1 or 2 or 3 years, then hopefully we're going to give her that comfortable retirement that we all want for her. The whole purpose of this journey with Lucy was to give her good quality of life. It wasn't about buying her more time, it was buying her more quality time. And I really feel by seeing her today, enjoying the company of her loving mum and dad, that's exactly what we've given her.
happiness is back in to our life, especially Lucy. And tell you the truth, that's the result that we were hoping for. So, yeah, big thank you.
Well, cheers to that and cheers to Lucy.
Well, Lucy will drink to that, and so will we. Cheers, guys.
Oh, God, we're keeping you up.
Tired.
Hey? Oh, dear, it's just after midday.
It's time for her afternoon nap.
Good girl.
The next seat.
It's the start of the day for mobile vet and mum of two, Alison.
Seatbelts on. Hold on to your milk, darling, because if that falls, it's going to stink the car, yeah? Perfect timing. 4 minutes late.
And already the day's jam-packed.
So a typical crazy day in the life of Alison is juggling mum duties and school duties and work duties. It is multitasking from the moment I wake up to the moment that I go to bed. Daddy will pick you up first and then pick Ethan up. Then you've got to go to the shopping centre because Dad's got to pick up your birthday balloons. The school drop-off, school pick-up, and managing the appointments between that as well. Push the handle in before you slam the door. The handle might fall off. Oh my gosh, Mummy's going to be late. Hurry. And I've still got to fill up the van with water. So we've got 7 appointments all over Brisbane today, so it's going to be a busy, busy Friday.
After a quick school drop-off, it's straight to the first patient.
Oh my gosh, how's he grown? It's so good to start the beginning of the day with a puppy. You've got the cute factor. I've watched this puppy grow since it was 8 weeks old. He's brand new with the family. The family's never had a dog before, so just a full checkup and a vaccination today. Any vomiting or diarrhea?
No, but he does like eating the licky mat.
Okay.
He ate a lot of the licky mat.
Oh, he ate it. Okay, you can get a toughened one too.
Yes.
Did it come out in his poo or did he?
It did.
It did. Okay.
So we thought, well, I guess he'll survive.
I think you've got every single bit of peanut butter out of it. I don't think you've missed. Oh, yep, you've missed one spot. All right, buddy, you're done. Aww. There we go. Okay, so we're off to see Daisy now. Daisy is a beautiful cavoodle. Hey baby, do you want to come inside? The only dog that wants to go into the vet. Oh my goodness, this dog just, I don't know what it is. You melt my heart, buddy. And I'm just gonna work really today on her lower back and her left knee where she's got that luxating patella. I use laser therapy a lot in my rehabilitation consults. It's really great for musculoskeletal conditions. Bye, baby. See you next week.
With 2 patients down, Alison's pumped up for her session with Dash and Maisie.
Hi, how are you? Hey, okay, come on in. And what we're doing with her is we're taking it really slow, but we've got her front legs on sort of a wobble cushion. So it's giving her some instability on the front legs, so she actually has to put more core strength to stabilize her back legs. What we're doing is making sure that we're strengthening her back because these breeds tend to get a lot of back issues. Look at her muscles. Go forward a bit. Just look forward. Yeah. Mom's doing such a good job.
For her final visit of the day, Alison is joined by Nurse Amber.
I am thinking, you see, right straight ahead. Am I allowed to park there? There was someone that parked there before.
They're off to meet Tiggs, a cat who's recently been adopted by a doting couple.
Hi, how are you? So when I meet Tiggs, she is quite severely overweight. And apparently this is a little bit better than what she was a couple of weeks ago. You are gorgeous. I can see why they took you home. Even though we want her to lose weight, we want her to lose it gradually because sudden weight loss can actually be more detrimental, particularly in cats. All the fat metabolizes and goes into the liver and they get a condition called fatty liver disease, which is really dangerous.
Is that a belly rub? the belly rub.
Oh my gosh. So the work day is over. I can take a big breath that I've seen all my beautiful patients, and now it's back into mum mode. It's late, I've got to get home, I've got to blow up all these balloons. It's my daughter's 7th birthday party tomorrow, so I've got to find the energy and get this done. It is 10 o'clock at night, and Ethan, Dad, and me have finally finished building this rainbow. So off to bed. Good night, everyone.
Hey, buddy. It's okay, darling.
4-year-old Charlie has been rushed into the Bondi Referral Hospital SASH after getting a bit too greedy at a birthday party.
Oh, Charlie. You're a silly sausage.
Charlie's bad boy behaviour has a history of landing him in serious trouble.
This is not the first time that he's done this. We've brought him in before for eating hair ties, and he ended up in surgery, unfortunately. It's really upsetting that it keeps happening.
What's happened?
Charlie has eaten a ribbon that was wrapped around one of my daughter's birthday presents.
Okay, did you see him do it?
Did, yes.
Okay. We see it really commonly in young cats where they eat foreign objects, pieces of string, ribbon, bits of toys. But you would think by the age of 4 that a cat has grown out of that. Not Charlie. He knows he's done something wrong.
He does.
Hiding with his head in the corner. While I'm examining Charlie, he's really scared. I think he's feeling a little bit sheepish. He knows he's done something wrong. He knows he's at the vet and he does not want to be here. I need to have a look in his mouth.
Charlie.
Oh, you're terrified. Time is of the essence. It's highly likely that that ribbon is still in Charlie's stomach. If we wait, that ribbon could move out of his stomach into his intestines, and that's when he would need surgery. What we need to do now is make him vomit. All right, so wish me luck. Hopefully we will be able to make him vomit. If he needs to have an endoscopy, I'll come back out and talk to you, but we're just trying to prevent him from having surgery.
Fingers crossed.
Okay.
So fingers crossed he doesn't need surgery, because that's quite traumatic for him, for us. Don't want to go down that route again.
Hey, Mark, this is Charlie. Sweetheart, we just want you to not have surgery, honey. The first step is I need to get Charlie to vomit up the ribbon. Now that can be quite unreliable in cats. They don't all respond to the medication. All right, let's give you your injection.
Lisa hopes a shot of apomorphine will make Charlie vomit.
Big vomit and it's all over, that's it.
It's hard waiting. I'm getting a bit stressed now. It's been a while.
Hey, buddy. Come on, little man.
After 30 minutes, Charlie's still not showing any signs of bringing up the ribbon.
He's looking sleepy and I really don't think it's going to happen. I've got to go now and tell Caroline the news that he's got to have an endoscopy. She's not going to be happy. It's been a long wait. I'm sorry.
So what's next?
So next we're going to give Charlie a general anesthetic and we're going to put a camera down his throat and we're going to try and pull the ribbon out of his stomach. I'm just hoping that the ribbon is still in there. Okay, there's a small chance that it has moved further along, and if that's the case, he may need surgery. Okay, but there's no guarantees, as you know.
Okay.
All right.
This could be surgery for the second time, so I'm really stressed. I don't want him to go into surgery again.
Good kitty. You're a good boy.
It's now plan B for Lisa and the team. Ribbon-eating Charlie has to have an endoscopy.
Unfortunately, we weren't able to make Charlie vomit up the ribbon, so what we're left with now is we're going to put a camera down his throat into his stomach. Hopefully the ribbon will be there, and if it is, we'll try and grab it with some forceps and pull it out of his mouth. It's apparently this long and bright pink.
If it's that big and that colourful, we should be able to see it if it's there.
Medicine vet Dr Chris Greenwell is performing the endoscopy.
Having a piece of ribbon that's 50 centimetres long inside a cat that's only 4.5 kilos is going to cause major problems as it moves out of his stomach into his intestines. Hope it's in there.
Yes, so do I. It'll make it much easier. We can just see it.
Come on, kitty.
The minutes are ticking by. and there's still no sign of the ribbon in Charlie's stomach.
The worry is that that ribbon will move out of his stomach and into his intestines. We can only get it out with an endoscopy if it's in his stomach. If it's moved past that, well, the only option is surgery. Come on, Charlie.
It's all still there. Yeah, there it is.
Seeing something. There it is. All right.
Yeah, that's our ribbon.
Removing foreign bodies with endoscopes can go two ways. They can be really difficult or really easy.
Okay, so back a bit.
When it comes up, there's a chance that it could cause an obstruction. Hopefully it won't end up going that way.
Cool. All right, so here we go. We've grabbed it with the forceps, and now we're just pulling it back up at the stomach now. All right, it's now into the esophagus, and so we just keep coming up. It should come out the mouth shortly.
There it is. It's like a party trick. As we're pulling out this length of ribbon, it just keeps going and going and going.
Oh my gosh, look at that.
Wow.
Holy hell.
I cannot believe how long this piece of ribbon is, and I cannot believe that Charlie managed to swallow it. Far out.
A whole lot.
It is longer than the cat. Caroline is going to be one very relieved and happy owner. You're awake. Did you see what you ate? Look at this. Do you remember this?
Charlie will spend the next few hours recovering from the procedure, and then hopefully he'll be able to go home.
Okay, Charlie. All right. Now you just have a good sleep, sweetie pie. Hi, buddy. Your mum's going to be coming in to get you, and you can get out of this place. Even though Charlie's looking a little bit sheepish and feeling a bit sorry for himself, he needs to know that he's a very lucky boy. We couldn't make him vomit, but we got the ribbon out with the endoscope. We avoided him having surgery, and he should thank his lucky stars that he's going home. Someone is very excited to see you.
Is he?
Owner Caroline is relieved that naughty Charlie's ordeal is finally over.
Hello. Oh,
Look who's here. Charlie, this is it. This is the last time you eat something that you shouldn't. It's even hiding from you. I think he's hiding his head in shame.
Charlie's really lucky. He has had surgery once before, so he's lucky that he didn't have to go down that route again.
So here's a little reminder of what was in his stomach.
Oh my goodness.
Now that is bigger than him.
That's scary, isn't it?
It's quite unbelievable. So he is incredibly lucky.
Hopefully this is the end of Charlie's adventures eating things. We really don't want to be coming back here again. Shall we get you home to your brother?
Caroline is such a dedicated owner, and Charlie is so lucky that she brought him in when she did. He is one very lucky cat, and he's going home one very happy boy.
Oh, Charlie, you're a silly sausage.
Hey, ease up, ease up. That's not what we want. Today, I want to show you one of my all-time favourite birds here at the Australian Reptile Park. It's the proud, strutting boss of the rainforest, the magnificent cassowary. Love the watermelon. Bit of squash. You're fussy on your fruits, ain't you? In the cassowary world, females lay the eggs, but the fellas do all the work, sitting on the nest, then looking after the chicks. Sounds very domestic, but cassowaries are not an animal you want to mess with. Now, they're really powerful, about the same force as a male red kangaroo. Have a look at the power in those legs, that incisor in the middle. They jump up to about chest height and then rake down with enormous force, potentially splitting whichever thread it was open. Call me crazy, but I'm about to step into an enclosure with one of these awesome, powerful birds. Good morning, chookies. I'm not going in with the big fellas. No way. The babies are more my size. Come on, you want a bit of tucker? Here you go, mate. Love your grapes. This little guy is Foghorn, and his mate is a chicken called Leghorn. We rescued Foghorn from a nest where all the other eggs were infertile. Dad was staying on the nest, and he just wasn't looking after this little guy. The chicken teaches him how to eat, which the cassowary didn't know when he was born. He's also company and just teaches him bird social skills for later in life. He's going to need those if he's ever going to breed in captivity.
And if a chook can teach him a thing or two, I reckon I can as well. Today I'm being Dad, and I'm taking Foghorn for a walk.
Thanks, Kaz. I put him down. He's only 2 months old, so he's still just getting his feet. He's quite clumsy. Come on, mate. There you go. That's a boy. Hey, over this way. Come on. You stubborn little fella. Come on. Hey, down here. Come on. Let's go. You see, what he's doing, staying right there in about my legs, is exactly what he'd do in the wild with his father. It's security. I'm safety. So he's going to stay right in close here and just tuck around. You right, mate? Well, look out. Can you imagine poor old Dad Cassowary? He's got 5 or 6 of these little guys all around his legs at once.
This guy's such a character. Off the path? Hang on, back again.
Come on.
Here I am, little fella.
Come on, mate. Here's your buddy. Here's Chook. You happy to see each other?
That's the fun bit. Now for something Foghorn absolutely hates, the weigh-in.
Come on, mate. Hey, settle down. Have a look at that. That's called playing dead. A lot of animals do it, and it's a last resort. When they're threatened or when they're restrained, this is what they'll do. Look at that. See, plenty of life still. And there he goes, back into it. Now, if he was grabbed by a big snake in the wild or something like that, this is what he'd do. Okay, so it's time to get a weight. And the way that we do that is just to pop him into the bag. Nice and dark for him, and it just settles him. That's the way, mate. Won't be long. The reason that we weigh him is just, hey, easy, mate, easy. Is just for a routine health check. We need to know that he's gaining weight, not losing weight, and that we don't have any health problems associated with that. 2.3 kilos. So he's up 300 grams in a week.
It's all good. At this rate, it won't be long before Foghorn's 2 metres tall. While he's still a little tacker, I can be his dad.
Come on, let's go.